Morning, everybody. Welcome to the Shareholder Committee for Dorset. It's the 1st of July. This is the first Shareholder Committee since the elections, so the constitution of the committee has changed and it's 5 new members. So please excuse any questions we may ask, which you may have answered previously. I suspect that will be the case. Can I ask that everybody who speaks on an agenda item, when they speak first, introduces themselves and give them the role? Make sure your microphone's on, obviously. And for reference, we're probably going to, well, we are going to try and move this meeting to Committee Room 1 or Meeting Room 1 or wherever it's been rebranded. It's not really a suitable space, we found. That's likely to be the meeting after next due to scheduling availability, which I think is December. Yeah. So watch this space. So moving on to the agenda proper, have we any apologies, Chris?
Thank you, Chair. Just confirm we have no apologies for this morning's meeting.
Agenda item 2 is the minutes for the last meeting. Obviously, as I said, it's a brand new committee. It's just for noting any issues to raise. No, in which case I'll take that as noted. Item 3, declarations of interest. Have any of the members of the committee got any interest to declare? Nope, not seeing anything there. Item 4, public participation. We've had no questions or statements received from the public or anybody else for that matter. Item number 5, questions from councillors. We haven't received any, though I will say that councillors who aren't on the committee are welcome to speak on any agenda item. Item number 6, terms of reference. They are in the paper. They are for noting. Do we have any issues to raise? Nope, not seeing anything. Item 7, Dorset Council Commissioning Update. So this is going to be presented by John Price and Mark Tyson. Over to you, John.
All right, there we go. Thank you for that. I'm Mark Tyson. I'm the Council's Commissioning Director for Adult Services to present this report. So it's a brief report that gives an overview of the work we've been doing in the past quarter and obviously builds on earlier reports to earlier meetings of the committee. We are working with Care Dorset on the development of the contract. People will be aware, I'm sure, members of the committee will be aware, I'm sure, that we have a contract that was novated over from Tricuro with variations, but this will be now a first full set of new specifications to govern the services and take account of some of the service developments that Care Dorset have worked on with us over the past year. And the intention is that that emerges alongside the 5-year strategic plan that the committee will receive in October. So those two documents will speak to each other, and the committee can be assured at that point that the business plan strategy for Care Dorset speaks to the contract that we've got with them. On to some specific service development matters. So the residential care, it's probably helpful for the committee to just be aware that we are currently in the tender process for the Dorset Care Framework for the lots around residential and nursing care. And the relevance of that is that we've obviously, in preparation for that and on the launch of it, now got a whole set of new specifications and a very clear sense of levels of complexity in residential care delivery for older people, and that's really helped with our dialogue with Care Dorset, and it helps for them frame their strategy, the company's strategy for residential care, so that it aligns to the Dorset Care Framework in terms of developing the acuity, so the complexity of the services that they can offer. I'm sure Care Dorset colleagues will talk more, I'm sure, in their update, but the Council have worked closely alongside Care Dorset in the changes to service provision at Sydney Gale House in Bridport, and we are moving into the phase now where we're working with them on the development of the new options for a reablement and rehabilitation centre on the Sydney Gale site in Bridport to replace the current outdated building. And I'll leave Care Dorset colleagues to say a little more about that. We continue to have success in our partnership with Care Dorset around the reablement beds and community reablement services, both of which have been very responsive and flexible during the what's called system escalation pressures. So where there's been challenges at the hospital and we've needed to have a system that can move people quickly, partners in Care Dorset continue to be responsive and supportive of the system and getting people into the next stage of their journey out of hospital promptly. In the coming quarter, we want to move that conversation into talking to Care Dorset more about how the reablement services can be at the front door of adult social care, not merely at the back door of the hospital. And that's really important that we start seeing that shift so that we are strengthening the offer we have to get people out of long-term care rather than planning long-term care around when they come through our front door. So that's a really useful, really important development for us in adult social care in the coming quarter and the year ahead. We've had new supported living services, and again, would want to kind of just credit Care Dorset with creative work in helping get new services underway, and also to look at the current service offer and think differently about how we're supporting people with learning disability in supported living schemes. And that's really important to us because we have a strong push in our strategy and our commissioning strategies to create options in county for people and to be able to move people from out of county placements to be within their communities in Dorset. And we see Care Dorset as a key partner in that. We've agreed the specification for an extra care scheme at St Martin's in Gillingham, and it will be opening in the late summer. The build is completing on that, and so we can provide further update on that opening at the next shareholder committee. We are also about to present to Overview Committee through to Cabinet in September the thinking about a new model for day opportunities, which of course will have a significant bearing on Care Dorset's provision of day services, but actually a very exciting set of options around rethinking how day services and day opportunities relate to wider community support and community networks in the towns and communities around Dorset. So we think that's a real positive, and it's going to be a set of developments over the next 6 to 9 months, I think, to invite colleagues from Care Dorset to then respond to the model that we're putting forward as commissioners for day services. Finally, just on the contract value and contract pricing, we've done quite a lot of work over the past 6 months with Care Dorset colleagues to understand some of the costs that were inherited when the company established, and now that the company's had time to get underneath the detail of all the services that they're operating and the cost basis for them. So we have worked with them on the contract price and provided kind of some uplift, which reflects the exposure of the company to our contractors almost exclusively, its source of income. Just one thing to say on that, and it's reflecting the council's financial position for this year and significant savings that are required in adult services. So I think, and colleagues in Care Dorset are fully aware of this, we're shifting having now based the contract correctly, we now need to think through some of the efficiencies that can be achieved over the coming year. And there's certainly no intention to kind of starve the company by reducing the contract excessively, but actually we do need to think about how we can achieve some efficiencies from services. So that's part of the contract, part of the conversations for the coming months. So I think I'll pause there. That's the Commissioner's report.
Thank you, Mark. Are there any questions? Councillor Ryan Holloway.
Thank you, Chairman. Yeah, Councillor Ryan Holloway, portfolio holder for corporate development, transformation, digital and change. Just going back, to 6.1, about the extra care, obviously, scheme in Gillingham. I just wondered, could you just possibly enlighten us a little bit as to what does that sort of scale down to of regards to extra care, and is that still on target for opening on the late summer? Thank you.
So yes, it's currently the target is, and it's still on target for September, late September opening. 55 units, I believe, of extra care housing in the Gillingham site, with Care Dorset as the care provider within that. So does that answer the question? Yeah.
Councillor Taylor.
Thank you. It's just a quick question. I'm Councillor Taylor, Jill Taylor, and I'm the Cabinet Member for Public Health, Environmental Health, Housing, Enforcement Services and Regulatory Services, and I think I also do tea making, but that one's not on there at the moment. Can I just ask a question on 4.3, please? You did mention that what you're looking at is reablement services at the front door rather than the back door, which is what we currently have. And I'm just wondering, to make this work, we need a really good, solid referral system in. And I'm just wondering how you're going forward and going to be looking at getting referrals into the system, because it's all about getting referrals early rather than late. And it's how you're going to re-educate and inform people who can refer into your service that they should be referring into your service.
Thank you. Yes, absolutely. So we currently, referrals into adult social care come from all parts of the current health and social care system. Part of the key to making the best of having a reablement offer at the front door would certainly be work with primary care. And so I think conversations through the integrated care partnership are kind of important. There's various conversations at the moment about kind of options for integrated neighbourhood teams, and our interest in that is certainly to make sure that we have the right connections so that local practitioners and primary care practitioners in the widest sense, so not just GPs, but their associated professions, can make those referrals in so that we've got then an offer to re-able somebody and almost prevent the crisis before it happens. And that's definitely our vision for the future. And I just sort of want to say as well on that point, it's not a question, it's not really an either or. It's not that there's nothing of that sort happening at the moment, but it's about balance. And we want to kind of get more of a balance and get more of that resource happening at our front door and as well as the hospital.
Can I come back? If I can just come back on that one. Thank you, Chair. I'm just wondering whether you're going to be looking at the likes of self-referrals in, and what our role is as members within that. Because at the moment I would signpost somebody, but I wouldn't refer. And if you'd be happy for councillors to refer, it may well be an additional resource for you. We're the eyes and ears of our communities. We know who's out there. And if I do feel, and I've felt in the past, that if we just signpost rather than refer in, then the referrals are quite often lost because the client doesn't take us up on our offers.
I mean, effectively, yeah. So everything comes through the access and assessment team and then will be triaged to understand whether or not a further social care kind of intervention is needed through our localities and so on. And it's at that point that the reablement service would be considered as part of the assessment process. So absolutely. And if you feel, I guess, that signposting isn't strong enough in a sense of kind of handing somebody into a supportive conversation, then maybe we can have a conversation out about how we build that into some of the work we're doing on our front door and on our information advice and all of the associated kind of, first point of call. See if we can get that written. Yeah.
I'm going to go to Councillor Somper first, and welcome. Thank you for turning up.
Thank you very much, Chair. You mentioned that some people were stepped up in the reablement centres from health, and there's a reference to that later on in the report. in the chair's report. So I'm wondering sort of about the length of time people are staying in that centre, which is a reablement centre. Has that required additional staffing from Care Dorset, or have NHS been able to step in and add some staff in to support those people that would ordinarily be in their hospital setting?
I think that might be a question that actually Care Dorset can probably better answer. If I can hand it over to Chris.
I can ask it again later on in the report, unless you're happy to respond. Thank you.
Thank you. Chris Best, Managing Director for Care Dorset. So the average stay within one of our reablement beds is 6 weeks, and we operate effectively a 1-to-3 ratio. So for every person each support worker that we have supports 3 people across there, and that process during the day will involve supporting individuals with their personal care needs. Well, there will be an element of reablement within the day as well. Our setup in each of the centres where we have reablement there is a kitchen area with washing facilities and so on and so forth, so that we can create a domestic environment for those individuals, so that when they do go home, they have the confidence and have built those skills, so that they're able to return home with potentially a small domiciliary care package, or in a number of cases no additional need. And there will also be night staff around to support with medication administration and so on and so forth. We are recruited in all of our reablement centres, and part of that, the reablement offer has enabled us to create some additional skills for our colleagues who, certainly those that were in the residentials before, were very much focused on supporting individuals to do everything, whereas in the reablement centres there's been a much more focus on those individuals doing as much as they can for themselves effectively.
Councillor Robinson.
Thank you, Chair. Just to go back to something Councillor Taylor mentioned earlier about utilising local councillors in local areas, and that's something that we very much want to be taking forward through a number of strategies in the coming months, not least of which through something called community conversations. With regards to referrals to care, with regards to recommendations and recognition of dementia, with regard particularly with issues of safeguarding, we want to be able to help local councillors recognise issues that they otherwise might not do, and then have the skills to be able to act appropriately, and others within the community as well. So it's very much the direction of travel that we want to head on.
Thank you. I have a question if there's nothing else from the members of the committee. I've got, I guess, the two. So it's the Sydney Gale House in Bridport. I guess I'm looking for an assurance that the residents there will be looked after, and obviously it's going to be a very stressful time for them to move, and obviously we need to look after their needs and also the needs of their families. However, is there a cost implication of the moves, i.e. are they moving out of a framework, which I presume is Care Dorset's, potentially into something else because that's the right thing to do? And I guess the second question is, I believe we own the building there. Is the intention that Dorset Council builds a new building there, or do we just retain the freehold and allow Care Dorset to build on it?
So the first point, absolutely the priority is what the current residents want for their onward journey from Sydney Gale House. So I can't at this moment answer exactly the implications, but the numbers of residents aren't enormous, so they sit, if I say they sit in our normal flow of business and referrals we would be expecting to come through for placements in any case. So absolutely defer to Care Dorset on the conversations they're having with residents about the future. And our locality teams are absolutely involved in that and making that as supportive and a process as possible. So hopefully be assured on that point. And then, yes, the discussion at the moment is about the council rebuilding potentially Sydney Gale House for Care Dorset to lease in the current way that it is. There are various options around that though, which we're currently exploring to get that right. So again, we can probably come back with a further update to the next shareholder committee on the proposals and the way forward.
Thank you. I don't see any other hands up, so we'll just note it, if that's okay, and move on to the next agenda item. Thank you. So the next agenda item is, I believe, item 8, if I put my glasses on. So it's Chris Best and Caroline Tapster to present. Thank you.
Thank you very much indeed. I'm Caroline Tapster. I'm the chair of Care Dorset, and I'm delighted to be presenting my regular report to this committee. I'm just going to say a few words by way of introduction and then hand over to Chris Best, the Managing Director, to talk about some of the operational delivery. We've gone into a little bit more background detail in the report because this is a new committee, and I'm also hoping that other new councillors might want to read it as well, because we are very proud of Care Dorset. And I think also picking up the earlier point, we'd like people to know what we're doing. In terms of our achievements, you've already heard about the increased levels of occupancy in our 6 residential care homes, which have increased from 76% at time of transfer to 92%. Also, the increased acuity and complexity. We have introduced a set of quality standards in all of our residential care homes that are over and above regulatory requirements, because that was another one of the issues that we inherited. The standard of care in some of our homes is not what we would want for ourselves or for our relatives. You've also heard quite a lot about the reablement beds. We're very proud of the fact we got those up and running so very quickly. And we now have 30 beds across Dorset. We've supported 147 people, saved, I think, nearly 3,000 hospital bed days. So it's a considerable saving to the NHS. But also it means that people are going home, which is where they want to be, rather than staying in hospital when they are, of course, medically fit to discharge. There have been occasions when beds have been empty, which is incredibly frustrating. And I think one of the issues is that there are many people within the health and care system who don't understand what reablement is. So when referrals were being made, they maybe didn't realise that the individual who was in a hospital bed could benefit from this thing called reablement. So we do still have, I think, quite a job to do to actually train all of our colleagues across the system in understanding what is there and what is available. Our community reablement teams have also been very successful in supporting people to come out of hospital and then reduce their ongoing packages of care at a considerable saving to the council, but also helping people retain their independence. You've heard about the new service for young people with a learning disability in Weymouth, which has just opened. That's for 4 people with learning disabilities and autism. And we are also looking forward to the opening of the new service in Gillingham. We've already recruited the staff. So we are ready, we are poised for opening in September. We're very proud of our recruitment campaigns. That you heard a little bit about that during the induction. What we've been able to do is to fill vacancies that we were told were very hard to fill through the very different way that we've been advertising some of our branding, but still recognising that even though I think between June 23, April 24, we received over 1,000 applications, we started 169 colleagues. So care is not suitable for everybody, but we are having people come forward. And finally, we're very keen to look at innovative ways of involving the people who use our services in the delivery of those services. We've recently put together a listening group, which includes people who use our services, and they look at our complaints, they look at it from different perspectives, and then feed back to the executive team. And last week, we launched the first meeting of our Community Development Fund, where we have a sum of money which is put together from our inherited amenity accounts, which we're going to use for small projects locally. And that meeting also includes people we support, and they had lots of ideas as to how we could spend the money. So watch this space. I'll now hand over to Chris.
Thank you, Caroline. Just to focus on a few of the areas within the report, and then obviously invite any questions. So just touching first on financial performance, and obviously the year-end accounts is a separate agenda item this morning. We are running a slight loss against our budget, and we are working through some efficiency plans to respond to some of that. Agency it has been a significant contributory factor in that, not because of a result of challenges in recruitment, but more a sort of sense of challenges in relation to productivity and the way that our workforce is deployed. So there's been a significant re-education of our sort of rota planners and our managers in the way that our colleagues are used and deployed, along with some of the challenges that come from a workforce such as ours in relation to sickness as well. And there are other efficiencies that we will be driving through in relation to how we procure things such as cleaning and other costs associated with operating our services. Caroline's touched on a number of the sort of operational aspects, and the question in relation to Sydney Gale is one that I might pick up here if that's agreeable to the chair. So we announced the changes in relation to Sydney Gale a couple of weeks ago now. We did that first by meeting with all of the colleagues. We felt that it was important that they were aware of that before we made the announcements more widely. Those colleagues understandably were concerned, but recognised that the decision was the right one to be made, and indeed there had been some doubt about Sydney Gale for the past decade. So I think in lots of ways, the sort of confirmation of its future was in itself a relief for colleagues. In relation to families and the people we support, we then spent the rest of that day calling all of the family members, some of which then came in the following afternoon, and myself and the Director of Operations, Ali Prince, met with those colleagues and answered any questions that we've had. We've been well supported by Dorset councillors, and members of the brokerage team have been present in the services as well, and those people we support who have capacity have been met with and spoken to as well. Indeed, a number of the people that we support have been taking the opportunity to think about the opportunity to move closer to relatives as well. So there are a number of people we support who have family a bit further away than they might like, and are working with the brokerage team to have a placement that is closer to their loved ones. All of the family members accept that it's the right and appropriate decision to be made, and we have maintained a presence within, so there's been senior managers present within the service over the course of the last couple of weeks. From a workforce point of view, we have now begun the collective consultation process with our 3 recognised unions, and those unions recognise and accept the decision in relation to the cessation of services at Sydney Gale, and are now focused on ensuring that colleagues are well supported through the rest of the process that they will need to go through. I think the other thing just to sort of mention in paragraph 16 is that over the last couple of months, we have had 3 quality monitoring visits from Dorset Council as part of contract management, and each of those have reported noticeable improvements from their previous visits, and a recognition that Care Dorset is driving up the quality of the services as well. From a workforce perspective, we've already mentioned in relation to recruitment, but the flip side of recruitment is not requiring it in the first place. And retention, we're pleased to say, is significantly below the sector average. And we put that down both in terms of the culture that we are and have introduced across the organisation, as well as the fact that we do pay favourably within the market. Certainly since I came into post, my focus has also been on adopting an environment of innovation, integrity and collaboration, and as part of that also driving a servant leadership model of culture within the organisation. So senior managers and support colleagues are focused on supporting those that provide care and support, and enabling them to do the best that they can be rather than getting in the way with unnecessary processes. And that certainly remains a journey for us, but I think colleagues have recognised that. And indeed, just reflecting back on Sydney Gale, I was there last week and one of the senior colleagues came up to me and said how pleased that she was that senior managers had been face-to-face to deliver those messages, and then stayed for the rest of that day to answer any questions, as opposed to delivering it via a Teams message or indeed even a letter. So I think we've been able to reflect our values in the way that we behave even in difficult situations. We've already touched on the composition of the board. One of the points I wanted to bring to this committee's attention is that we have begun a self-led governance review. The board has obviously now been operating for, well, close to 2 years, although recognising that Caroline's only been the chair for just over a year, but we felt that it was important to ensure that the board is doing the things that it needs to do, and obviously to offer assurance to the shareholder as well. So that we're in the process of that review currently, and we expect to report those findings. An interim report will go to the board in August, and then a final report will go subsequent to that. And a summary will come to October shareholders report meeting. We've touched on some of the growth, and as Caroline has already mentioned, we are very pleased to say that we've now recruited all of the colleagues, or certainly made offers to all of the colleagues that we need in order to deliver the commission service at Gillingham, which, as others have mentioned, is a 55-bed service, and we're very pleased that we're going to be the provider of that operation. So now that colleagues are in the process of being onboarded, that gives us a good amount of time to conduct induction and familiarisation with the service and Care Dorset's processes. And our manager has been recruited for that, and indeed has been in post for some time as well, so already is familiar with Care Dorset's processes and systems. The point that Caroline was mentioning there in relation to the Community Development Fund, just to sort of emphasise that the monies that are used for that are monies that were inherited through the previous provider and were made up of either fundraising that colleagues did previously, or money that was left to different care homes from family members. And whilst the board do need to confirm the two bids that were discussed last week, one of which I'm pleased to say will, we hope, train a number of people we support to become DJs, and to certainly operate some sort of person-centred music opportunities as well. So, and there's an opportunity, I think, for some employment for those individuals over time as well. Finally, I just wanted to sort of touch on that we have now a draft strategy, or business plan as it's referred to in the articles, and we intend to bring that to the shareholder for approval later on in the year. That strategy has been developed following time spent with the board. We also surveyed family members, people we support, and colleagues as well, in terms of things that they would want from their provider and their employer, and those are incorporated into the proposed strategy, and we believe speak to and respond to the commissioning strategies that Mark touched on earlier on this morning. That's everything that I wanted to say, so happy to answer any questions.
Thank you, Chris. Any questions? Councillor Biggs.
Yes, Bishop Biggs, Cabinet Member for Properties, Assets, Economic Growth and Levelling Up. I was interested to hear you mention the word productivity, which is something that's a key concern for me. Dorset geographical area is one of the worst performing areas of productivity in the southwest and possibly further afield. We know many of those reasons, but clearly your biggest cost, looking at the accounts by a long way, is staffing. So you've mentioned you're looking at productivity, which is about these efficiencies, inputs and outputs. It would be really helpful if we were actually able to measure those and say this is where it was, this is your gross value added before and after, and we can actually look at it and see how you're doing, other than something that's really hard to pin down whether the productivity is up, and it may be paying staff a little bit more, changing things to actually get more out. It's not about working staff into the grave. It's making a good place to work, but it's also about those movements around for community reablement you talked about. So there's plenty of things I'm sure you're getting to grips with, but if you could actually measure that and demonstrate to us, I think that would be really helpful. Thank you.
Thank you. Yeah, but I think productivity is in and of itself a sort of challenge to measure. I think coming into a number of the points that you raised there, we do have an ambition to raise levels of pay, and indeed the live discussions that members of the board, in fact, we will be having a discussion about it this afternoon. And there is, I think, a real challenge for us as an organisation to work through what will not be an insignificant amount of money to increase levels of pay, but what might we expect from colleagues as a result of that increased pay, whilst recognising that they are humans and that we need to ensure that they have a good standard of environment in which to work. There are some tools that we already use. So we have a system that routes certainly our community reablement in a way that's as most efficient as possible to ensure that people aren't travelling an excessive journey. And we're also in the process of reviewing all of our systems, and one of which we are considering is a much improved rota management system that will enable us to better identify where there is sort of downtime within the working day and how we might improve that going forward. So I think it's certainly something that I expect to see as a feature in our sort of performance measures going forward.
I'm not seeing any hands up. There is one. On the topic of pay, I would really encourage Dorset to try and become a real living wage employer. It's certainly an aspiration of mine and also of the current administration that Dorset Council and everybody it does business with become real living wage employers. So I'll just put that out there. Councillor Taylor.
Thank you, Chairman. And that was more or less what I was going to say. But could I also add to that one thing that has always struck me is the lack of career progression within the care sector. And that is something that we really, really do need to nail down. It would have a huge impact on retention. And I know it's a tough nut to crack because the obvious career progression for carers is into the NHS. And we've got to look at how we develop our career progression through Care Dorset to encourage people to stay with us. Our staff are our most important commodity, and we've got to look after them, and pay is just part of it. Can I, just on a general thing, thank you very much for the update on Sydney Gale House. That was where an awful lot of my questions were, and I'll take up some of the questions on housing-related issues to that later with officers, because that's going to be fairly sure outside of your scope. And just another one. I am incredibly pedantic. Can you explain what 8.6 means? Because I read that and had a very sharp intake of breath. Care Dorset estimates that its community reablement support has saved 5,000 weekly care homes. I didn't know we'd got 5,000 weekly care homes. Thank you.
Yes. I always like to slide at least one error into the papers just as evidence of readership, but thank you for that. So that word should be ours, not homes, so apologies for that. Turning to your point in relation to career progression, so I mentioned earlier about the Care Dorset Academy. So we are planning to develop our own academy so that we can grow and develop our own colleagues, and that will feature some different care progression pathways, as well as making good use of the apprenticeship levy and thinking about the qualifications that we're able to offer to colleagues. I think Care Dorset, as I mentioned earlier, and I think it's worth mentioning again, we are an organisation that supports a real diversity of individual, and I think that really does enable us to provide a real sense to colleagues of the different opportunities available within social care that will negate the need for them to either move out into health partners or indeed to other providers as well. Although having said that, when I worked in a neighbouring local authority, we did develop what we called the social care passport that enabled individuals to move around different organisations and get a sort of sense of the sort of area that they might want to sort of specialise in. I think also we, as part of the academy, colleagues, not all of them, want to move through progression, but want to specialise as well. So the academy will provide opportunities for individuals to specialise either in different areas, maybe dementia, maybe more frailty, and so on and so forth. So the academy, once it is born, will respond to those sort of career pathways as well. And I expect to talk more about that in the coming months once we've developed the people strategy that will supplement and support the 5-year strategy for Care Dorset.
Councillor Sompo.
Thank you, Chairman. I did have a series of questions, but they've been asked and answered in various guises. You spoke in 8.7 around improvements that have been carried out, but you also say that there have been improvements across most Care Dorset locations, which implies that there are some still that may require improvement. And I wondered if you might be able to expand on that a little. I have other questions, but do you want me to, you want to answer that one first?
Thank you, Councillor Sommer. In relation to where there are improvements still required, some of which are within our day service opportunities. So there have been some locations who, let me just go back slightly. So whilst our day services are unregulated, so the CQC don't regulate day services, we have applied the same standards across the board, and therefore there is some areas of improvement that is required as a result of the fact that those locations haven't been used to the same framework in prior to Care Dorset's terms, and so most of that is in relation to some of the paperwork that needs some improvements. So that's the point there, Councillor Somper.
Thank you for that clarification. That doesn't. It was just to understand if this was around buildings particularly, and obviously potential costs of those. It's a very good report. Thank you, as always, and very good reading. I'd already asked the question around the numbers of individuals who are remaining or are in reablement for over 6 weeks. You've answered that. That's kind. I just want to ask the chair and the shareholders. I'm not au fait with how internal self-led reviews are carried out, but I just wondered, is the chair and are the shareholders comfortable that that is a self-led review? You may well be. I don't see any reason. I'm not suggesting there'll be anything, but I'm just not sure if that is always how things would be carried out.
I don't really have an answer to that, to be honest. I hadn't thought of that. If I may, I'll defer to Grace. Maybe you can answer that, or Jen.
Happy for that to come back if no one can respond at this stage. It's for your thought, Chairman.
Sorry, that was a long way of saying, can we just check the agreements and come back to you on that? Because there's a specific list of things that the council would need to be involved in, and we need to take care about not stepping across that into aspects which are properly for the company to self-conduct. We'll have a look, and I'll update the committee.
Thank you. Sorry, I didn't mean to trip anybody up over that. I have read the papers, so really pleased about the opening finally of in Gillingham, and I hope there'll be lots of people from North Dorset who will be able to go into there. So well done on that, and also the excellent initiative around the Community Development Fund. I think that's marvellous. And I really look forward, actually, to learning more about that and to learning also about the impact that's going to have on all our residents and how we can encourage, as ward members, bids in for those, because I'm sure we've all got groups of individuals or who may wish to apply for some of this monies for local projects. So if you could let that be known to all when that's available and where they can apply that. Thank you.
Thank you. Anybody else? I've got a few questions myself. I got three, in fact. So I'll take one in turn. I guess the first one is about the community reablement beds. It's a great success story, but you also mentioned occupancy is not ideal. So can I ask what steps are being taken to address that, and can Dorset Council, through its membership of the Integrated Care Board or the Integrated Care Partnership, help in any way?
Thank you for your question. The process that we've been going through is our reablement colleagues have now been working with the hospitals themselves, joint ward rounds as well, identifying individuals that are suitable for the reablement service, as well as ensuring that our colleagues are on the multidisciplinary team calls that happen several times a day to identify individuals for discharge. As a result of those initiatives, we have seen improvements in the level of occupancy across our beds. I think it is about continuing to work in partnership and taking each and every opportunity to remind particularly hospital colleagues of the reablement service, and through being present, we have started and continue to see those improvements.
Thank you. My second question is about recruitment. So thanks to Councillor Somper, myself and Councillor Beryl-Lazard were incorporated in basically regular status updates with the transition from Tricura to Care Dorset. And after that, John Price was also on the calls. So thank you. I know from that the recruitment process after the transition has gone really well, and that staff really appreciate the new culture in the new organisation. And so thank you for that. And you mentioned that you're keeping pace with recruitment, but however, you also mentioned agency costs. So I know from my personal background through my family members that you can't eliminate agency, and agency does have a place in health and social care. Are you at a place where you're comfortable with that level of agency use, or are you planning to reduce it?
Thank you. As you rightly say, I think agency is part of the makeup of a social care organisation, and the skills of my teams are about minimising the use of that agency through the development of a relief bank, so that they have first call, and that's part of the work that we're doing at the moment. As I've mentioned elsewhere in the report, we do have a rigorous process that includes what we call the agency cap. So managers are required at towards the end of the month in readiness for the following month to tell us of the agency use that they think they might need throughout that month, either as a result of needing to cover sickness or other gaps in the rota that can't be filled by those relief colleagues. And that agency cap is either approved by the Director of Operations or, in her absence, myself. And we have seen a real improvement and a real education of colleagues in the use and request of that agency. There is still some short-term agency that's used, particularly out of hours. So we have an out of hours on-call process that's required for the approval of agency, and that goes through to the second line on call, which is managed by a member of the executive team. We have the final call on whether or not to approve agency. To complement that, we have developed a tool for teams in relation to ensuring safe staffing levels. So that might not be the level of staff that they might operate with during normal times, but it's the safe staffing level, similar to that which was used during the pandemic. So a long-winded answer to saying that there is still room for improvement in relation to agency, but we're confident that the process that we put in place manages that, and we can drive out those further improvements through things such as improving some of the productivity and reducing sickness further.
Thank you. And I do have one further question, I guess, or maybe it's a statement. So it's on item 37, where you say Care Dorset recognises that it has not got everything right in the recent past and has resulted in negative public relations. So I was thinking, whether should I use the F word or not? But yeah, let's go for it. Fern down, okay? I appreciate this. It's not the shareholders' job to get involved in operational details, but essentially, it's a Dorset Council building of which you are the tenants, and the things that happened there weren't ideal. It may have resulted in some opportunities, shall we say, but it could have been done a lot better. We probably should have had a lot more consultation with local ward members and a bit more heads up, I think, because there's been a lot of consequences for lots of people arising from that decision, which is currently been rescinded, as far as I can work out. But can I just implore you going forward that when you make similar decisions, and there's another one in Wimborne, I think, that we're given the heads up and we're consulted first, please.
Yeah, I think I can only apologise again, and I think we recognise that we didn't get everything right at all, and there has been a huge amount of learning. I think that's what we say on these occasions, and we will certainly ensure that we work much more closely with colleagues, because there will be other times that we make decisions that may well not land well with local people, so we need to make sure that they are done in a way where we get the best possible outcome. So I hope I can give some reassurance. We have learnt. Thank you.
Oops. Thank you for that. I don't see any other hands, so we'll just close this by noting the report. And thank you. It was a very good report. Thank you. So the next agenda item, I believe, is 9, if I remember it correctly, because I can't see my screen. So this is the year-end accounts. And so again, over to Chris and Caroline. Thank you.
Thank you, Chair. I think the first point to make in relation to the first year accounts for the period ending 30th of September, so they have now been filed with Companies House as was required for us to do by the 30th of June. We have reported a loss of just under 400,000 against revenues of 29.5 million, and that is against the backdrop of a challenging transfer from the previous provider, some of which we've already talked about this morning, and has necessitated us investing in systems as well as people to drive up levels of quality that was inherited from the previous provider. And we have already talked about the bedded reablement that obviously the funding for that comes through the Better Care Fund and has positively impacted on our overall financial position. As is mentioned, in terms of the sort of cost of poor quality, we do estimate that has cost adversely between 700,000 and £1 million as part of addressing those challenges. Part of that has been our investment in additional colleagues. It has also been in relation to bringing in some external support. So we brought in an external organisation to conduct some independent assessments of each of those locations that enabled us to create some development plans or service improvement plans phrased to sort of improve that quality, which we're now seeing the fruits of in relation to the quality levels, and I think Dorset Council's quality teams are noting those improvements as well. As is already mentioned, obviously pay is our fairly significant and the principal cost of this organisation, and obviously there has been a pay award that was given. The nature of the transfer means that the transferred colleagues are subject to different pay negotiations through the National Joint Council pay negotiations, and as an organisation we are required therefore to pass on the improved pay that comes through that vehicle to colleagues, and that isn't without its challenge, given that we have no influence over the negotiation of that, and the uplifts that Mark referenced in his previous report obviously support the financial impact of those increases. Our next significant cost is property. And we have, through the re-evaluation of those properties, seen the change in rent levels as a result of those independent valuations. And I think they were the points that I wanted to point out in the paper, so happy to answer any questions.
Thank you. Are there any questions? Richard Biggs first.
Yes, looking on page 37 of our report, the financial KPIs, it seemed quite bland, really. I just wonder if there's more detail behind that. I mean, simply saying number of care staff, you might have grown the business so you have more care staff the following year. Again, I'd much rather know how efficient they are, what the value added of those staff are. Is that something that's going to be worked on, or is that standard reporting?
Thank you, Councillor. So within two things to say. So the proposed strategy has a series of key performance indicators within it as well, which we will bring forward to the shareholder at the next meeting for approval or discussion and approval, should I say. And the contract with Dorset Council will have some different key performance indicators as well going forward. So it's a work in progress, I think it's fair to say at this point.
Councillor Somper.
Thank you, Chairman. I think I forgot to say Councillor Somper from Beacon Ward earlier. Just remembered that. Yes, a quick question around the Better Care Fund, from which you are funded. And I don't know if you were able to answer this now, so I apologise if you can't and you can get back to me on it. I wonder what the split is, or is there a split, between the Dorset Council element of the Better Care Fund and the health contribution to the Better Care Fund, or whether or not it just comes from one?
I think that might be a question for our commissioning colleagues.
Yes, it's there are two different sources going into parts of the contract for different elements of delivery. So, for example, the reablement beds are from the health additional contribution. Some of the residential care provision will be from our kind of placement budgets. So,
If I may, thank you. Yes, I just wonder perhaps you might be helpful to understand the actual numbers and that actual breakdown, and what potential impact it might be should there be any reduction at some point or considered reduction at some point from our health partners, perhaps, as an example.
Thank you for that suggestion. I certainly know there's some talk about value for money for Better Care Fund going around from my conversation with Patricia Miller last week. If there are no other questions, we'll just note the financial statement. Thank you very much. I think the next item is item 10, which is the forward plan. I'm not planning to read through it. Have any of my colleagues got any suggestions, comments, omissions, things they think shouldn't be on there, etc.? Nope. In which case, we'll just note that. Item 11 are urgent items. There aren't any urgent items. And item 12 is exempt business, and there is no exempt business. So I'll close the meeting at 1 minute past 11. And thank you for coming. Thank you.